Do you have a prescription for eye drops or medication that goes into your eyes and ever wondered what the color on the cap signifies, like what kind of drug it is? Well, we're going to cover that in this video today. And there's a bunch of different colors and different things we use in eye care in order to help take care of patients. So let's start with the first one. The first category of eye drops can be known as anti-inflammatory or steroid eye drops. This will come sometimes in either a pink cap or a white cap. It just kind of depends on the pharmacy and what they have available. And we use this a lot of times to calm down inflammation. Surgeons will use this after some level of surgery, like cataract surgery, things in that nature to really just get the eye less inflamed and calm down. It can also be used in uveitis and other eye inflammatory based conditions. You'll also have, that we don't do this by prescription typically, but we also administer numbing eye drops in office for certain procedures or techniques or different things. And even surgeons will use this in surgery a lot of times. But we don't typically write prescription for numbing eye drops just because it can cause some problems with the cornea if you use it too long or too frequent or in too short of a period of time. The next category of eye drop comes in the form of a gray cap with a bottle. So the gray cap signifies an NSAID, a non-steroidal anti-inflammatory drug. Basically, how this works is a common one that will be used to calm down some level of inflammation is known as ketorolac, for example, often used after some level of surgery sometimes. They're not as strong as steroids, but they're probably considered a little bit safer and maybe just cause a little bit more eye irritation issues than steroid eye drops do. But they have a place and a purpose, and why prescribers, such as myself, use this in certain scenarios. The next eye drop color cap is the tan color. This can signify a lot of times antibiotics or antiviral eye drops. And if there's a bacterial infection, viral infection, anything in that pathological spectrum, we like to use the antibiotics or antivirals to really calm down whatever bacteria or virus is really impacting the eye, but also causing the patient discomfort, visual issues. Maybe it's a corneal ulcer, maybe it's some type of infection. Maybe it's something got into their eye. Maybe it's pink eye. Maybe it's some type of virus. Maybe it's viral conjunctivitis. It could be used for anything in that category of pathologies. The next category are the red caps. This would be mydriatics or cycloplegics. And a lot of times the mydriatics will dilate the pupil, the black hole in the middle of your eyes that's right in the middle of the color portion of your eye known as the iris. Usually we administer those in office if we need to dilate a patient's eyes in order to do like a diabetic exam or diabetic retinopathy exam or see a retinal detachment, or sometimes we even put patients on cycloplegics in order to be able to freeze the accommodative system, the eye's focusing system, like for say a younger patient that's having focusing difficulties, or if there's like a uveitis and eye inflammation that really needs to be calmed down, sometimes that will kind of freeze the focusing system in order to help the patient feel better and not feel as light sensitive anymore. The next color cap category is known as green. This is known as the miotics, also most commonly referred to as the pupil shrinking drug. So the mydriatics or the cycloplegics, they are red and they increase the size of the pupil. The miotics will decrease the size of the pupil. The most common one that a lot of you may have heard of will be known as the prescription drug Vuity. This is the active ingredient pilocarpine, basically. And pilocarpine is known as a miotic because it will constrict the size of the pupil down just a little bit. The next category is known either as blue or yellow, and this can be used in glaucoma treatment, specifically in the form of beta blockers. This can be timolol, this can be some other things that can either in combination, sometimes it'll be a blue cap, but by itself it can be a yellow cap. That really helps lower the eye pressure in a very specific way that goes after these little beta 2 receptors located into the eyes that are responsible for producing eye pressure fluid, aqueous humor. And this kind of slows down the production of it just a little bit in order to lower the eye pressure just a little bit. The purple category is known as the adrenergic agonists. You may have seen this in the form of brimonidine, the over-the-counter version called Lumify, where they've cut the concentration of brimonidine down significantly. And basically, this is used to lower the eye pressure as well in glaucoma treatment. The brimonidine, not the Lumify. The Lumify is supposed to get the redness out of your eyes and does not lower eye pressure. The orange cap category is known as the carbonic anhydrase inhibitors. This primarily is used in glaucoma treatment as well too. And again, it can lower eye pressure to keep things more stabilized, but you'll see this with an orange cap on the top of the eye drop prescription bottle. The last category is known as the turquoise cap category, known as the prostaglandin analog. You may see this in the form of more glaucoma management medication. This can be in latanoprost. This can be in a whole bunch of different categories of glaucoma drugs that can really help take care of things in order to lower the eye pressure and keep that optic nerve super healthy. They can sometimes cause a little bit of redness as well too, but they're extremely effective to lower that eye pressure. Those are the main color categories as far as what you can expect when you get an eye drop prescription. If it has a certain color to it, it usually is going to fall in line with one of these categories of controlled substances known as drugs that will go into the eyes, that have a specific purpose and have a specific meaning and have a specific treatment plan for what you talked about with your eye care professional. And it's important to know the colors because a lot of times the names can be kind of weird, they can be confusing, they can have a whole bunch of strange pronunciations. But if you know the color in which it's prescribed for, it can kind of help give you an idea for why you're using the eye drops and how often you need to be using them according to your prescriber's instructions, but to know what we're doing and know what you need to be doing to take care of your eyes. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington, and we'll see you next time.